Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Dopamine agonists. We have different dopamine agonists. These dopamine agonists include we have pergolide, pyridil, apomorphine, then we have lergotril and rotigotine. So these are the dopamine agonists, and all these are actually D1 agonists. The most of them are D1 agonists. D1 agonists are short acting drugs which are well absorbed, and they have high first pass metabolism. They have high first pass metabolism, and they can cause nausea as a side effect. The other side effects are, one side effect is they can cause nausea. They can also cause postural hypotension is also seen, and mainly the psychiatric side effects are also more with these D1 agonists when compared to the other drugs. They are rarely used in Parkinson's disease.
thank you and thank you for watching.